Physical therapy for ankle sprain. So, what is ankle sprain? So, first, I will show you a video clip of a basketball player who got an ankle sprain.
Yeah, second time today we have seen a player land on another foot.
An ankle sprain is a common injury. It is where one or more of the ligaments of the ankle are partially or completely torn. Inversion type lateral ligament injuries represent approximately 85% of all ankle sprains. The incidence of ankle sprain is highest in sports population. Poor rehabilitation after an initial sprain increases the chances of the injury reoccurrence. Moving on to the risk factors, several intrinsic and extrinsic risk factors predispose an athlete to chronic ankle instability. The most common risk factor is previous history of sprain. A previous sprain may compromise the strength and integrity of the stabilizers and interrupt sensory nerve fibers. Sex, height, weight, limb dominance, postural sway, and foot anatomy are intrinsic. Extrinsic risk factors may include taping, bracing, shoe type, competition duration, and intensity of activity. Next is the mechanism of this injury. Lateral ankle sprains usually occur during a rapid shift of body center of mass over the landing or weight-bearing foot. The ankle rolls outward while the foot turns inward, causing the lateral ligament to stretch and tear. When a ligament tears or is overstretched, its previous elasticity and resilience rarely returns. Some researchers have described situations where return to play is allowed too early, compromising sufficient ligamentous repair. There are three aspects of ankle sprain. First is the lateral ankle sprain, which is the inversion and plantar flexion of the ankle. Second is the medial ankle sprain, which is the eversion of the ankle. And lastly, the high ankle sprain, which is the internal rotation and dorsiflexion of the ankle. The clinical presentation of an ankle sprain are the following. Tenderness, swelling, and bruising can occur on either side of the ankle. If patient presents with description of cold foot or paresthesia, suspect neurovascular compromise of the peroneal nerve. Able to partially weight bear only on the affected side, no bony tenderness, deformity, or crepitus present. Patient present with inversion injury or forceful eversion injury to the ankle may have previous history of ankle injuries or instability. Moving on to the management. Mild ankle sprain is natural. It will fully recover within 14 days, and it needs taping and follow-up to evaluate healing progression. First-time lateral ligament sprains can be innocuous injuries that resolve quickly with minimal intervention, and some approaches suggest that only minimal intervention is necessary. And in severe ankle sprain, physiotherapy is required with functional therapy of the ankle shown to be more efficient than immobilization. Functional therapy treatment can be divided in 4 stages. Moving on to the next stage as tissue healing allows. These functional therapy treatment stages are inflammatory phase, proliferative phase, early remodeling, late maturation, and remodeling. In inflammatory phase, the goals are reduction of pain and swelling and improved circulation and partial foot support. The most common approach in this stage is the Price protocol: the protection, rest, ice, compression, and elevation. For protection, Protect the ankle from further injury by resting and avoiding activities that may cause further injury or pain. And rest. Advise rest for the first 24 hours after injury, possibly with crutches to offload the injured ankle and altering work and sport and exercise requirements as needed. And for eyes, apply a cold application, 15 to 20 minutes, 1 to 3 times per day. And for compression, apply compression bandage to control swelling caused by the ankle sprain. And for the elevation, ideally elevate ankle above the level of the heart, but as a minimum, avoid positions where the ankle is in the dependent position relative to the body. Then in proliferative phase and early remodeling, the goals are recovery of foot and ankle function and improved load carrying capacity, and improved muscle strength, active functional stability, foot ankle motion mobility like walking stairs, and running. The to-do list of this phase are: first is the education, where you seek information about the possible preventive measures. Next is the practice foot and ankle functions like range of motion, active stability, motor coordination. Practice balance, muscle strength, ankle foot motion, and mobility. Then last is the immobilization, like taping or bracing your ankle. And lastly, the late remodeling and maturation phase. The goals are to improve the regional load carrying capacity, walking skills, and improve the skills needed during activities of daily living as well as work and sports. And that's all I can share about ankle sprain. I hope you learned something. Stay safe and keep away from pains.